January 6, 2009. The chair recognizes the gentleman from Colorado, Mr. Polis, for 60 minutes.
Thank you, Mr. Speaker. Mr. Speaker, over the last month, I've asked my constituents to share their health care stories with me so that I can share them with the nation with regard to how we can improve upon our current health care system and some of the problems that exist that many Americans face every day. One of my constituents from Boulder asked that her name not be used. When she was 17, she was diagnosed with HPV virus that causes cervical cancer. It wasn't an easy diagnosis to reach. She had the symptoms of a miscarriage, but she wasn't pregnant. That was later verified by the doctors. The only other syndrome that matched her symptoms was cervical cancer. Because of her age and the fact that she hadn't been sexually active for long enough to develop lesions, her doctor said it was statistically impossible for her to have cervical lesions. She said it was most likely a problem with the pill. She returned every day of the week, had exams, and was given no information. She continually asked for a test to see if she had cancer or tumors, but her doctor refused the tests and said they would be a waste of money and insurance probably wouldn't cover them. Even when she said she'd pay for the tests, she was denied them. She asked for a referral to a different doctor, and the doctor wouldn't give her a referral for the same reason. Statistically, nothing is wrong, they said, and it would be a waste of money. Finally, this young woman asked her mom to come with her, and after making them wait for an hour until the office closed, the doctor had a conference with other doctors and finally gave her a referral. She gave an appointment, found out what was wrong, and had surgery to fix it. Thank goodness that her mother helped her out with the cost. Now this young lady is having similar problems. She saw her new doctor to see what was wrong and decided they need to run a few tests. She didn't tell her, however, that the 6 tests would add up to over $1,000 and her insurance only covered $300. When this young lady from Boulder, Colorado, was 20 years old, she went through what too many Americans are victims of, and unfortunately she was raped and she contracted herpes. She started generic medication, but it didn't work, so she was prescribed Valtrex, which has no generic, and now it costs her out of pocket $200 a month just for that medication, which she can't afford most months. Madam Chair, it is for women such as this across our country that we need to pass health care reform so that people don't have to be told no by their doctor, no by their insurance company, and they can get ongoing treatment for conditions that aren't their fault, might have been misdiagnosed, but they still have a healthy life ahead of them. And by passing health care reform now, we can ensure the next generation of Americans won't have to go through what this young lady in Boulder, Colorado did. Thank you, Mr. Speaker.